to be here chatting about medical billing in 2024. We'll be covering best practices and KPIs to streamline your revenue operations, as well as review a few of the key 2024 CMS code changes impacting primary care this year. And a little bit for those of you who are not already an Elation customer, a little bit about Elation. We're very focused on primary care, and here at Elation, we envision a future where primary care owns its powerful role in healthcare and every patient has a doctor they trust. That is absolutely the mission. We understand too how hard it is to accomplish this too in today's new world, but we are doing everything we can and want to work alongside you to make sure that you're enjoying your work, patients are cared for, and you're also getting paid fairly for it. And a little bit of additional background, Elation started in 2010. Brother and sister Kina and Conan Fong had a family in the medical business. Their father is a physician. They identified an opportunity. They saw the cumbersome legacy systems out there and the real struggle that it was to convert over to these electronic health records. And so that long ago, back in 2010, from their family's living room in Walnut Creek, they joined forces, leveraging Kina's computer science and economics background and Conan's healthcare, finance, and management expertise to launch the first clinically focused EHR from scratch. One of the key things being the clinical first philosophy, which is and was and still is sort of a radical idea that the technology should be able to provide physicians with the freedom to focus on their patients and offer support rather than disruption in the delivery of care. And still focused on that today. Elation currently serves over 24,000 clinical users across all 50 states, caring for more than 12.8 million patients with the leading technology platform for high value primary care. So today, again, just reviewing the agenda. We're going to be giving an overview of medical billing in 2024, talking about some of the best practices for billing today, how you can focus on SMART goals and KPIs to maintain and increase practice revenue. We'll be giving you a walkthrough of Elation Billing, and then going over some of the focused 2024 CMS code changes that will impact us this year. We'll follow it up with a Q&A session. So again, feel free to drop those questions in the chat, and we'll do our best to answer as much as possible at the end of our session. So about to kick things off, but we wanted to just do a quick poll and see which topic you guys are most excited about learning today. You should see something pop up on your screen in just a moment. And let me know if you can see this poll. If someone doesn't mind dropping in the chat, I'm not able to see it. I want to make sure you guys are able to see it. Excellent. Okay, all right, so quick results in Elation Billing features, as well as the 2024 CMS code and fee schedule changes. Me too. Those are both what I'm excited about as well. So excellent. And we're going to get a little bit of everything, but we certainly have a good amount of focus on those. So I think you'll be happy about that. So quick intro for our speakers. First up, we have Josanne Bilchek. Joining us as a guest speaker, Josanne has 2 decades in healthcare management. She excels as the VP of RCM services at J&J Consulting and Billing Services. Her career spanned from hands-on healthcare roles to strategic consulting, offering solutions to enhance practice profitability. Her comprehensive approach showcases her commitment to streamlining billing and coding processes for better revenue outcomes. I can personally say it's been a pleasure to be working with Josanne. She brings a lot of value to the primary care physicians that she works with on Elation Billing as well. We're also lucky to have Kelly Schoenfeld with us today, Director of SMB Billing Operations here at Elation Health. He'll be giving us a product walkthrough on Elation Billing. Kelly's a co-founder of Lightning MD and was pivotal in developing the practice management system that later became Elation Billing. And as the Director of SMB Billing Operations, Kelly's background in nursing and medical billing enriches his role, focusing on empowering primary care doctors. And he's a proud graduate of California State University, San Bernardino with a BSN degree. Super excited to have Kelly here with us, and also privileged to work with. Myself, I'm Brian Esser, Principal Product Manager at Elation Health, also a former nurse and co-founder of Lightning MD, and very excited personally to be working with the Elation team and this mission-driven group focused on improving the healthcare system and the provider experience. Have a lot of personal experience with that, and really happy to be part of this group that's working towards a brighter future there. And thank you for your patience with all the intro and getting everyone in the door. And with that, we'll kick things off, and I will pass it over to Josanne to take us into the content.
I need to take myself off mute there. Thank you for the introduction, Brian, and thank you to Elation Health for inviting me to be a panelist today. I appreciate the opportunity to speak to the providers and to share some insight on improving practice efficiencies and financial outcomes. I have really enjoyed working with the team here at Elation for the last several weeks in preparing for this webinar. You guys are absolutely amazing and so passionate about helping providers. So I was really, really happy to get to know you guys. So we all know that and have felt that healthcare has undergone some changes. And it has been pretty significant the past decade. There's a higher number of providers retiring than new ones that are entering the field. Hospital systems are increasingly employing providers and leading to a reduction of those independent practices in many areas. Nurse practitioners and other healthcare professionals are stepping in to fill some of the gaps. However, the stark reality is that in many areas, we're facing shortages of providers to care for the population. The providers that are currently practicing are challenged by the task of caring for larger and larger populations of patients than any generation prior. The evolving landscape of healthcare is increasingly challenging for medical business owners and providers. While maintaining a focus of patient care and quality is paramount to all of us, the reality is that attention to the financial side and the numbers of the practice is key. Balancing the dedication of your craft with the business aspects of running a practice can be overwhelming. Rising inflation, increasing minimum wages, Medicare reimbursement cuts that we face every year, new treatment methods that have additional costs that come along with them add to the complexity of this. It often feels like the system is working against you to, and to prevent burnout and ensure sustainability. Finding tools and solutions to manage the business side effectively is essential. This allows you to continue providing the care to your patients and looking at their needs while also navigating the demanding environment of healthcare. One of the key items that I advise practices on is automating as much as your practice can, putting automation in place where we can without feeling like we're taking away from the patient experience in any way. Automating workflows can streamline processes, reduce manual tasks, improve overall efficiency without compromising patient care. Adding automation and features that do not add to our staffing needs or our overhead costs or put more responsibility on our current staff is the only way forward. Making sure you are putting programs in place that will free up your in-office staff but increase productivity and that patient experience is what we need to focus on. I'm going to go over a few items that I often advise providers on adding or utilizing in their practice. Kelly will also go over a few of these Elation features in more detail later, but for now, I want to do a quick overview of how we can automate the workflows in your office. The first is going to be online scheduling. We all know the morning routine in our office. We get in the office, we turn on the lights, maybe we start the coffee pot, we walk around and make sure that the reception area is ready for patients, and we unlock the front door. And then we take a deep breath and we brace ourselves and we take the phone off answering service. And then our staff sits there and watches the lights just light up as calls start coming in and those lights start flashing. The first hour or more of each morning is fielding those immediate need patients who have been waiting throughout the night to call for an appointment. Online scheduling can be a game changer for most offices. By allowing patients to book appointments directly, you can reduce the morning rush of phone calls and streamline that appointment process. Patients appreciate the convenience of being able to schedule appointments online, and it frees up your staff to focus on other tasks. Plus, online scheduling can help fill up those last-minute cancellation and no-shows more efficiently. Online scheduling allows for patients to schedule whenever they need. I know I personally pulled out my phone at about 3:30 the other morning, and I went online and I scheduled an appointment to be seen later that next day. Knowing that this was done, I went back to sleep. There were no phone calls, no waiting on hold, no setting an alarm to be the first one to call in to get that last appointment. Patients can book appointments at any time, even outside of office hours, reducing the need for those early morning rush calls. It also minimizes the risk of overbooking or scheduling errors, as patient can see in real time the availability and be able to choose a suitable slot for them to come in and see you. This is not only a benefit to the patients, but it also eases the workload of the receptionist, allowing them to focus on other important tasks first thing in the morning. So patient engagement is next, and intake paperwork. We all know that intake paperwork could be a topic in and of itself. We have registration forms and authorization forms and consent forms and HIPAA forms and record release and treatment policies and payment policies and on and on and on. There are so many forms that we need to fill out and that they need to be reviewed and signed by the patient. Intake paperwork is indeed a crucial aspect of the patient experience and in practice efficiency. Providing patients with these forms ahead of time, whether electronically or by email, can significantly streamline the check-in process and improve overall satisfaction. So ensuring that the demographic information is accurate and up to date not only facilitates communication, but it also helps with billing and collections, which is important to me. So patients appreciate the convenience of completing work prior to, as it reduces stress and anxiety on the day of the visit. Last thing I want when I'm not feeling well is a stack of papers on a clipboard. So by focusing on improving that intake process, the practice can enhance the overall patient experience and make healthcare visits more about the care itself rather than those administrative tasks that we have to focus on. Next is insurance verification. This is one of the most important key features that are often overlooked. Insurance verification is indeed a critical step in the billing process, and automating it can greatly reduce rejections and denials. Ensuring that insurance information is accurate and up to date at the time of scheduling, or at least on the day of the visit, is key to a successful billing, being able to bill it out timely and getting it billed in that quick turnaround time. By automating this process, practices can streamline their workflow and avoid costly errors and delays in getting those claims paid. So next is copays and coinsurances. Encouraging patients to pay their copays and deductibles before or at the time of service is essential for maximizing collections. Implementing a clear financial policy, keeping credit cards on file, and offering convenient payment options can help ensure that patients meet their financial responsibilities. This approach not only improves collections, but also enhances the overall patient experience by reducing financial surprises. And it also just streamlines that process for them. These are the main ways to automate and streamline your practice. And so now let's go ahead and move on to the business side of things. So tracking key performance indicators, also known as KPIs, and setting SMART goals are essential for maintaining the financial health and overall success of medical practices. KPIs provide insight into various aspects of a practice's performance, while SMART goals help set specific targets for improvement. Reviewing these metrics on a regular basis allows practice leadership to identify areas of strength and areas needing improvement. Kelly will also provide some guidance on how to access and navigate to these metrics in the system, but I want to do a brief overview of some important ones that we should monitor daily, weekly, and monthly. So SMART goals are important in all businesses, but in healthcare, it is super important. When we focus so much of our time and energy taking care of our patients, we can sometimes put the business of healthcare on the back burner. When the focus of patient care, it's easy to overlook the business side of running the practices. So setting short-term and long-term goals and regularly reviewing and measuring progress are essential in ensuring the success of our healthcare business. Some goals, such as monthly income targets and patient visit quotas, are straightforward and can help guide daily operations. It's also important to set goals for other key areas, such as reducing no-shows, increasing follow-up visits, and attracting new patients. Regularly reviewing overhead costs and the profitability of services. For example, we all had issues with vaccines a couple of years back. It can help us ensure that the practice is financially sustainable. Additionally, it will help us know when to hire or bring on additional providers or staff to support the growth that we have. By keeping a close eye on these SMART goals, healthcare providers can not only deliver excellent patient care, but can also run a successful and thriving practice. Charges, payments, and adjustments. These are three key KPIs in any practice. Tracking charges, payments, and adjustments is indeed essential for understanding the financial health of your medical practice. These key performance indicators provide a clear overview of revenue generation, payment collection, and any adjustments that had to be made. By monitoring charges, payments, and adjustments on a regular basis, meaning daily, weekly, monthly, practice owners and managers can quickly assess whether the practice is meeting its financial goals. They can also identify trends and anomalies that may require further investigation. Regularly reviewing KPIs can help practices stay on track financially and make informed decisions about optimizing revenue and profitability. Next, we want to talk about AR by insurance and AR by patient. A lot of us glance at these, but we actually need to monitor these accounts receivable a little bit closer. By looking at your AR by insurance and AR by patient, you're able to manage the financial health of the practice. AR aging reports provide insight into the status of outstanding balances and can help identify areas of improvement in billing. For insurance AR, the goal is to have the majority of your charges in the current to 30-day category. Typically, we're looking for 60 to 80% of our charges to be in that current and 30-day mark, depending on the practice and the services offered. The 60, 90, and 120-day categories should each have about 10 to 15% of charges sitting in those categories. Having some amount in the 60, 90, and 120-day category is a great indicator on if appeals are being done and follow-up is being addressed. We can make sure that we're capturing all those additional funds that may have been denied or bundled and should not have been. Patient AR, that's a little bit different, and it may vary practice to practice. The reason for that is that we might have payment plans. Patients might be making smaller payments on larger balances. And as a practice, the individual circumstances. So there might be a patient that we know has a balance. We don't necessarily want to forgive it or send it to collections, but it's going to be sitting there. It's important to review your AR for patients regularly to ensure that balances are expected and to verify that clear communication and payment arrangements have been established and maintained. By regularly reviewing and managing AR aging reports, practices can improve cash flow, reduce bad debt, and ensure that outstanding balances are being addressed in a timely manner. So, number of days in AR. This is one that gets overlooked quite a bit. Tracking the number of days in AR is important for monitoring the efficiency of your claims processing and understand payment timelines. Industry benchmarks suggest that this metric should typically range between 30 and 70 days, with the lower number indicating faster payments from insurers. When a number of days exceeds 50, that's a red flag for me. That signals that it's time to investigate the AR and identify delays in payments. An increase in AR days could indicate that there's going to be a decrease in cash flow soon. Highlighting the importance of addressing any issues promptly is what this number will tell us. While not all claims and payers will follow the same timelines, monitoring the number of days in AR allows practices to forecast expected payment timelines and take proactive steps of improving cash flow and efficiency in claims processing. Right now, I will tell you industry-wide, that number is going up. And so we really need to start paying attention to what that is showing us over the next couple of months, why things are straightening out. So number of patients seen. Tracking the number of patients seen is absolutely essential for understanding the financial performance of a practice. Each patient visit represents revenue for the practice. So monitoring patient volume is vital for reaching financial goals that have been set. By knowing the minimum number of patients needed to reach that financial goal, the practice can set weekly and daily visit targets. Tracking metrics such as no-shows and cancellations can help identify opportunities to increase patient visits and to make sure that we're meeting those targets. Overall, monitoring patient volume is key for managing the financial health of a medical practice and ensuring that revenue goals are met each and every month. Insurance payer trends. So this is actually one of my best reports. I love digging into payer trends. So monitoring insurance payer trends is critical, absolutely critical for managing the financial health of your practice. Understanding the reimbursement and patient volumes associated with each and every insurance provider helps practices make informed decisions about which insurance plans to continue accepting, which ones we might need to renegotiate contracts with, or potentially which ones we need to discontinue working with. By analyzing payer trends, practices can identify which insurance providers are the most profitable and which ones may be costing more to serve their patient populations. This information can guide strategic decisions to optimize revenue and ensure the financial stability of the practice. And so now I will turn it over to Brian.
Thank you so much, Josanne. Really appreciate that. All very cool information. I know we've got some questions coming into the chat too for later. So we'll keep them coming in if you have any. And right now I'm going to pass it over to Kelly Schoenfeld for our overview of Elation Billing. Let me just pass the mic here. And okay, so thank you for your patience. Kelly, you should be able to take it away.
Okay, I am going to take it away. Thanks, Josanne, for all of that. That was really good info, and I'm going to try to expound on that a little bit. There was a lot of talk about the KPIs, and you'll see some basic info here on the dashboard. One of the things that we get complimented on the most is the ease of use of our system, and it's very simple to learn and to master it. And it's basically because we've broken things down to a very, very basic level, with just the 9 icons across the top here. But so for KPIs, you'll see, your charges for the month, and reports will be a lot more extensive than this. You'll see payments coming in, even the write-offs. We have a lot of interactive bells and whistles, so you can look at the practice and look at the different providers in the practice and the locations and kind of change the looks, and you can see, dollar amounts. And over here is the work list, which our billers absolutely love because you can organize denials, rejections into like categories. So you could, send medical records to all 14 of these at once instead of onesie twosie. Maybe if you're doing the flu shot, you didn't have the code yet, you're just putting it in a bucket and tagging it. You're able to work all of those all at once. So some basic KPIs here. To dig a little bit more in, we would go here into the reports, and let's give ourselves a lot of data here to work with. So there's 4 different ways to kind of look in at your numbers. I know Josanne mentioned patient count, and snapshot is a really good one to look at for, practice admins, office managers, and physicians that just want to see what's happening that day or that week. And you can do this like 1 or 2 minutes, right? So we can look and see how many patients have we seen, this week. How many claims have we submitted? Where's our charges at? Our charges are always going to be larger than our receipts because most practices will be charging a percentage, above Medicare, like 150, 200% Medicare. The demo system here is showing, 1,000% up, but realistically, these numbers will be more like, this is 5% up, maybe this is 2% down. And you can look at these matrix and compare same time last year, same time last month. Maybe you want to look at the last 3 months or, from the beginning of the year. You can set that all up and then take a little quick peek in at the AR. Anything beyond 90, 120 days is definitely of concern. And we can see this practice for insurance AR is like getting completely out of control, right? So real quick peek in to see, hey, what's the status, what's the state of the nation of the practice? Visualization's a lot like what it sounds like. These are the KPIs, for the practice, so we can see revenues. This is really helpful to identify, hey, when's the slow times of the year? When are we super busy? When are we going to have to, have full staffing available? When should people go on vacations? You can account for a dip in, revenue, like the dip is coming, and have extra money in the bank for that. So that's really helpful. Another KPI is looking at provider revenues individually, and you could take, certain providers out of the equation and look, and this is really helpful. Say if maybe you hired a new nurse practitioner for the practice and you're like, hey, not doing too much, but they're up 400x there, probably a good hire. And then looking at your locations. So this is really nice if you, you're hiring more providers into the practice, you're trying to actively grow, maybe you're adding new locations, you want to see how they're stacking up against what you're doing elsewhere. So all these are just meant to give you insight into your practice, and use those KPIs to make some sound financial decisions. Narrative is really popular one too. We can kind of see that with the other reports though. So we're going to open these up and just take a little quick peek at it. All the reports will be white labeled to your practice. So if your Dr. Smith's family group, that's what it'll say there. And narrative is pretty unique for us. We basically saw that doctors were asking pretty much the same questions every month. So let's just create, a brief overview. Number 1 question, hey, what's our revenue this month, right? That's a big one. What doctor brought in what? What's our number 1 location? What codes did we bill the most frequently? How many times did we actually bill those codes? Who's our biggest payer? Looks like this is probably a cash pay practice, right? One thing that's unique to us is our work list. So there's full transparency between, the office manager position and the billers. They can see like, hey, there's these things that have been denied, maybe rejected by the clearinghouse that need to get worked. So everybody can see there's a problem and kind of work out a plan on how to fix that. But full transparency is something you have to have if you're going to run a practice successfully. Basic information, here's how many locations, providers, what percentage of Medicare you're charging, and then we also tell you, hey, where do most of your patients reside? Because if you don't have a location there, maybe you should open it there. You'd have a captive audience, and you'd probably be pretty successful doing that. So we give you information that's not just throwing a lot of numbers at you, but stuff that's supposed to be helpful. And then here, of course, Josanne was alluding to, aging and then, percentage that you want to have in the AR. And this is, really, really bad. So, you're looking for, maybe 10 or 15% over here and keep that low. You'll be able to see all of the payments, et cetera. And then this goes on and on, all your codes, locations, providers, et cetera. So in the sake of time, I'll just maybe show you one more thing. We've come out with recently, we always get requests for reports, and generally we have a lot of stuff, but we're not perfect, and we listen to our customers and see how can we make this better for you. And so something that we just added is being able to print reports to PDF was the standard before, but now you can put all of these in Excel spreadsheet and manipulate the data in any way that you wish. So charge and financial transactions and refunds are something that we recently added. We take our customers seriously when they ask for things, and we actually build things. So charges, financial transactions is pretty extensive. It's a data dump for the month. So with all of that stuff, should be able to get the KPIs you need, and be happy to talk with anybody later if you had any more questions and whatnot. Be happy to schedule time. But otherwise, that's it for my portion, and thanks for hanging in there with me. Appreciate it.
Excellent. Thank you so much, Kelly. Really appreciate that overview. And we'll go ahead and keep it moving and dive right into the next focus of our webinar today, the CMS code changes.
Thank you. And thanks, Kelly, for showing a lot of the reports that we use every day. So code changes. Staying up to date on code changes is absolutely something that, I educate everybody on that works with me. It's critical to making sure that medical practices are ensuring accurate billing and reimbursement. CMS releases updates annually in October, which include new, removed, and revised codes. Understanding these changes can have a significant impact on coding for your practice and increasing your revenue. It's important to review these changes every single year and assess how they may affect your practice. Some changes may require updates to documentation or coding practices to ensure compliance and proper reimbursement. Some codes they take away, and some codes they give us new ones. So keeping abreast of these changes can help practices thrive in an evolving healthcare landscape. So overall, in 2024, there were 230 new codes added to CPT. 49 were reviewed and 70 were revised or changed. I want to go over just a few of these that may have some big impact on your offices this year. So first is going to be the G2211. Now, this one has caused a big stir in the industry. Everyone is talking about G2211. So basically what it is Medicare acknowledged that the current payment structure for straight office visits may not fully reflect the complexities or the holistic nature of care provided by a primary care physician. So adding G2211 allows providers to more accurately capture the comprehensive care that they provide to these long-term patients. So there's a couple of things that go with that. It's for an ongoing relationship. Does that mean I can't bill it for a new patient? No, you can. If you have a complex patient coming in for something that you are going to be treating them for long term, you can add this G2211. It is an add-on code. It cannot stand alone. It has to be added to an E&M visit. So your 9920 codes and your 9921 codes, this would be in addition to. And now this is the biggest item here. You cannot bill it if there's a modifier 25 on your E&M. So if you are doing a punch biopsy or you're doing an ear cleaning or there's some other procedure that you're doing that modifier 25 is necessary, you're not going to use G2211 at that time. So if you have someone that's coming in maybe for a 3-week blood pressure check, and it's going to be a straightforward 99213, 99214 based on complexity, that is when you're going to add the G2211. It's for long-term care of a patient that you are treating a complex issue with, okay? Next is going to be 99358 and 99359. So this is a super exciting code. I don't know how many years providers have asked me, do I have a code for reviewing records? Well, yes, we have a code for reviewing records. So it's used to report the total duration of non-face-to-face time spent by a provider on prolonged care before or after patient care. So what that means is when you've sent a patient out to have CT, MRI, maybe sent them to a neurology consult, and you're reviewing all of those notes and reports prior or after the visit, you can go ahead and add that 99358. So it has to relate to an E&M visit. So a lot of providers have asked, can I bill it the next day? There's been a lot of controversy because these codes are not new. We've had them for a while, and it used to be that it had to be within the same day. Now it just has to relate to the E&M visit. So you can bill this standalone. It used to be that you couldn't. So if you don't get to the reports until tomorrow, we can go ahead and bill that 99358 tomorrow. However, you need to make sure that it is documented that it is for date of service, 3/5/2024, spent time reviewing records, charts, and consults on 3/6/2024. Most of the time, we want to add this to the E&M someday, but if you just can't get to it till the next day, you can bill that separately. So according to guidelines, if you spend less than 15 minutes of non-face-to-face time, we're not going to bill it separately. So if you're just looking at labs real quick, it's only taking you 15 minutes, we're not going to add an additional code. But if you're spending more than 15 minutes reviewing all of those records, we're going to go ahead and do 99358 up to the first hour. And if for some reason it's going to take you longer than an hour to review everything, then you can add a 99359. Next, this is a wonderful code. I am so happy that they gave this to us. So all of us know that we cannot do pelvic exams without someone else standing in the room with us. And so what CMS has done is they have given us an administrative code, meaning that they are giving us a code to pay for our MA being there to assist with pelvic exams. Depending on where you are in the country, this is an additional $20 to $32. And it's an add-on code, meaning it cannot stand alone. So however you are coding your well women or your pelvic exams now, you're going to continue coding it the same way, and you're going to add this 99459 code for staffing costs. So over the last year and a half, there's been a lot of confusion about prolonged E&M. And so I'm going to try and clear that up for you today. So 99417 is an add-on code, cannot stand alone for prolonged E&M time. Now, because they changed how we code E&M and they've added a time factor to that, in order to use the 99417, you have to be at a level 5 visit already. So you have to be at a 99215, 99205, all the level 5 codes. And so basically what this means is that the visit took longer than our normal 54, 55 minutes. So once you hit over that and we're going 15 minutes more, we're going to bill that. So for example, we have a patient that has really high blood pressure. We're just not comfortable letting them leave the clinic. And so maybe we've given them a little medication and we're saying, hey, we're going to have you sit here and we're going to monitor your blood pressure for the next half hour. Once we get it under control, we'll go ahead and let you go. So what you're going to do is you're going to go ahead and bill the 99215 based on time, along with all the reasons that they're there. And then for every 15 minutes that they stay over, so if the patient was there for 90 minutes, we're going to go ahead and bill that 99215 with 2 to 3 units of the 99417. Now, it has been suggested that we put a line note in, letting them know why the patient was there longer. And what we have found personally is that it is stopping auto denials of this, and we're getting that 99417 paid right through. So make sure that we're adding a line note for observation or whatever reason that we're keeping them longer. So there have also been significant changes to COVID. So they have given us a COVID admin code. So if you're going to be giving the COVID vaccine, you're going to charge the 90480, and then you're going to have a code for the vaccine based on who produced it and the dosing for that. So that's 91318 through 91322. So you're going to have to look up the NDC to make sure that you're billing for the right COVID vaccine that you're giving, but you're also going to bill that 90480 for giving the vaccine. I'll also mention here before we move on, there's also new codes for point of care testing for both COVID and RSV. So if you're doing those point of care tests, make sure that you've looked up the correct codes, because once again, those are going to be based on what tests you're using. And then the final code that I want to go over, and this is another one that we are so thankful that they finally given us, it's caregiver training. So basically, this is for strategies and techniques to facilitate patients' function at home and in the community without the patient present. So if we have mom that's running into some cognitive issues or maybe aging issues, and daughter or husband are calling to talk with you, are coming in to see you to talk with you about how do we care for mom, you are able to go ahead and bill that 97550 for the first 30 minutes of conversation. Now, if the conversation's deeper than that, like I think we need to put her in a home and you've got all the siblings there and it's going to go longer than 30 minutes, the 97551 is for each additional 15 minutes that you're talking to them. So, mom doesn't have to be there, but we're going to bill mom's insurance for talking to the family about how we're going to care for her. They've also given us 97552, which is group caregiver training. So in your practice, if you have a certain group of patients, maybe Alzheimer's, dementia, diabetes, and you have a caregiver group training, they've given us that 97552 to do some group training as well. So that about does it for the overview of code changes for 2024 today. And I'll go ahead and turn it back over to you, Brian.
Thanks so much, Josanne. Really appreciate that. Always learning a lot here, and I think that's going to be great information for us and the physicians that are billing this year, and hopefully bring in some more revenue with that. So glad we're making headway. We have been getting some questions in, so I'm going to kind of popcorn a couple of questions around. And we'll hopefully get as many answered as we can today. If your question's not able to be answered today, we're not going to forget about you. We will follow up with you directly with an answer. So really appreciate you putting those questions in and all the feedback as well. So the first question is for Josanne. We discussed a few of the 230 code changes that we talked about. Can you elaborate on a few others? I know the focus was largely on the ones affecting primary care. Are there any others we should take note of? or where
You know,
could we find more information?
that's a great question. So there were 230 code changes and additions and removals this year. So today's focus was really about private practice. And the majority of code changes this year were in laboratory and radiology. And so those really didn't come into play for our conversation today. Um, so what I do every year is there's a CMS seminar that I go to, but there's also a book. It's called CPT Changes for 2024 or whatever year we're in, an insider's view. And so you can order these directly from CPT. I think they're also on Amazon. And I get that book every single year so that I can review all of the changes that are going to be important in my clinics.
Awesome, great tip. Thank you very much. I will jump the next question to Kelly regarding statements. So when sending statements at the end of the month, does it have to be through regular mail, or can I send email and text statements? If so, what is the cost?
Great question. Yeah, statements could be sent via regular mail, email, or text. For email and text, you'll need to gather that contact info from the patient, of course, up front. Probably also have them sign and give their permission that the patient wants to receive their data that way. For mailed statements, there's 85-cent cost due to postage. But for the email and the text statements, pretty much the electronic part, those are free. So you could do as many of those you want for free.
Excellent, thank you so much. Let's see. Let's talk about a question here with a bit of, I've got a couple of questions around denials. I'll first pass this to Josanne, and then I'll speak a little bit about what our plans are at Elation this year around denials as well. So Josanne, what strategies can we employ to reduce claim denials?
So the biggest way to avoid claim denials is making sure that we are double checking that our diagnoses are matching our service lines, making sure that our modifiers are correct, and that insurance and patient information is correct. So I will tell you the majority of denials that we end up getting is because the name was spelled wrong, or patient is known in the office as Beth, but at Medicare she is Elizabeth. And so making sure that all of that information corrects is going to help, and making sure that we're going through the scrubbers. Beyond that, my team works denials and rejections every single day, and so if we're seeing a trend, maybe we're getting the same denial over and over again, that means that we need to educate staff, maybe the provider, on what's happening, and so that we can correct that right away. So really it's about just staying on top of those rejections, denials, making sure that we're understanding where they're coming from, and making sure that we're putting policies in place to make sure that they don't happen again.
Awesome, thank you. And then Joe, just keeping in that same vein, I think that was a good segue to mention that in the first half of this year, we're working on upgrading denial management features in Elation Billing to improve how billers handle denied claims. We're anticipating a significant cut down in time-consuming processes around posting and following up with denials. We already have some great features built in, like one-click appeals and other things, but one of the things that we do here actively is to engage with our users, listen to feedback, and work on features we think will deliver the highest value to our customers. We're not going to stop doing that. We pride ourselves on the partnership we have with our customers and continuing this mission to enhance primary care, and of course to help you get paid consistently and reliably. Some of those updates will include an updated ERA auto posting workflow, new payment detail page, key information will be more accessible, and these enhancements are consistent with the customer feedback that we've received, and we're excited to continue bringing you new improvements and upgrades. Let me jump to a question for Kelly. How can I easily access EOBs without having to pretend I'm submitting an appeal? What are some of the ways that you can access either an ERA or an EOB within the system?
Okay, yeah, good question. For the ERAs, all of that stuff will be set up. If you're not already on Elation, you go through an enrollments process where we'll do that along with you, but then also teach you how to do it so you're not overly dependent on us. For the paper payments that come in, and you can't, totally avoid that, unfortunately, EOBs would have to be scanned in your office and uploaded into Elation Billing into the document center. You would find that under tools. And from there, you could either, post those payments, directly from the EOB. We always recommend billers work off of 2 screens. You can post those EOBs. You can also, when you have those open, you could work through maybe half of it, save it, come back to it later without losing your spot. You're also able to link EOBs to a patient or a claim or a payment, and then that'll be saved on the patient screen. So you can easily access, payments that have come in that way. So it's not like a needle in the haystack. We try to make that as easy as possible for you, but good question.
Thank you very much. And there's a question here. Is there a way to track the work of a non-licensed practitioner that is working under a physician MD separately so that we can account for remittances separately? Great question. And the plan here is we'll be introducing a new feature for Incident 2 billing in the second quarter of this year, specifically designed for that purpose. So hopefully that's exciting to you. That will enable you to track these activities and revenue for the either non-licensed practitioners or mid-level practitioners. Basically, when you're doing an Incident 2 billing that's going under the primary physician for the practice. There is currently a workaround within the system, just using multiple locations. Pretty simple thing. We just create an additional location that's indicative that provider was involved. But as a result of the feedback and the need for this, that's why we're adding this feature. So look out for that early Q2 of this year. Let me scan for the next question. Let's see. Okay, so Josiane, this sounds more like on the consulting front. I'm concerned about rising overhead costs. How can I reduce overhead in this year? Any tips for reducing overhead this year?
Oh, yeah, this is a question that we kind of field all day long. Overhead is one of the most pressing issues with cost rising across the board. And reimbursement has really kind of been static for healthcare for quite some time. So the way that we kind of try and tackle this is we want to make sure that every patient, when they are leaving the office, has a next step. They have a follow-up appointment, whether that's 3 weeks, 3 months, or only their yearly visit. We want to make sure that we're making sure that they are coming back. Like I said earlier, making sure that we're adding some automation in there where possible, where we're reaching out to the patients, where we're making sure that we're reminding them that it's time to make an appointment, getting them to use those online scheduling tools, things like that, to make sure that we're decreasing our no-shows. And then exploring a hybrid DPC model where maybe we're adding memberships the VIP benefits that are outside of regular healthcare. We can look at doing some of those things to bring in that membership money every month so that we can count on that no matter what's going on with the insurances. And then really lastly, and the biggest one is looking at and renegotiating your contracts. If you've had contracts that have been in place for more than 2 years, it might be time to renegotiate with them and secure some better rates. So off the top of my head, those are things that I kind of throw out to clients all day long. And so that's where I would start looking at how to increase revenue, decrease overhead a little bit.
Excellent, Josanne. I've got another question coming for you. A couple of them around some of the codes we went over today. Just a quick reminder, if we don't have the specific data, or if it's a deeper dive, we'll certainly get back to you with an answer. But 2 questions around 97550. One is, wants to confirm, is 97550 an add-on code? And the other is, with 97550, can that be billed on a phone call with a caregiver that's out of state?
Okay, so we've actually had this question before. So it can be billed on a telehealth, but not on a telephone call. So it needs to still be an appointment. And so as long as it is looking as an appointment where you're seeing the caregiver face to face, having those conversations, it can be billed, and we need to go ahead and make sure that we're using, place of service telehealth. In some insurances, we need that modifier 95 for that telehealth visit as well. And then the additional question is it a standalone? It is a standalone code.
Excellent, thank you very much. And Kelly, there was, I think, Josanne mentioned, when it comes to patient AR, it's really different for every practice. Sometimes you want to send some patients or some balances to collections, other times not, because of a hardship scenario that you're aware of. But the question is, for patients with large balances, is there an option to send them to collections with Elation Billing?
Yes, there is. It's really similar to sending statements. If you're already on Elation Billing, you know this, where you click on patients and then you'll see send statements, but you'll also see send to collections. And so in there, it'll give you parameters if the patient has a balance over X, and they've received X amount of statements. So our feeling is they are not going to pay. You could generate a list, and that list will get all of the pertinent demographics, everything else, put it into a spreadsheet that can be given directly to a collections company. You do not have to go search and find all of this stuff. We'll do it for you. One thing that's kind of hand in hand with that, if you don't like sending people to collections because it's kind of a little nasty, gets the patients upset, gets the doctors upset, you're getting paid pennies on the dollar, what you could do is set up payment plans, which could be done on the patient page. So you just find that patient in the payments section, you would just select payment plan, put how many months this patient has to pay this balance off. You might even give them a little discount just for starting to pay you. Something's better than nothing, right? And every month a blue statement will be automatically generated for that patient, so they can follow along with their balance until it's paid off. So whether if you have an appetite for collections, we can easily do that, but we really recommend payment plans too.
Thank you very much. We're going to go ahead with 2 more questions, and then we're going to wrap up for today. We know everyone's busy, and we really appreciate your time. If any of the questions weren't answered, look out for a follow-up from us. So 2 questions, Josanne. This first one is for 99417. Does this need any modifier when billed with the EM code like 99205?
No, it is an add-on code. No modifier is needed.
Excellent. Okay, perfect. All right, and then One last question here about what features should we prioritize when selecting a medical billing software? I'll take this one. So when you're choosing your medical billing software, it's important to prioritize features that streamline the billing process and really are going to enhance your revenue cycle management. You want software that offers, comprehensive claim management, ideally automated eligibility checks, like we talked about. One of the aspects of automation you can add to your practice. You want real-time claim status updates. Very important to stay on top of claims. And detailed reporting analytics. As we talked about, to achieve your SMART goals, you want to look into your KPIs, daily, weekly, monthly. The other thing that's really can be really streamlining for your software vendors, your office, and just speeding up your workflows is integration. So if you have an integrated system or an all-in-one system, it's going to make things a lot more streamlined. Usually when it's two standalone systems, well, there's nothing wrong with that. There's certainly more chance for issues with data, errors going from one system to another, a lot of switching between two systems, and that can add up to time that could be spent on more high value tasks. So lastly though, I think a lot of folks that would benefit from something that is user friendly, has good customer support, and just can help you scale up your practice. And that's all things that we're trying to achieve here, and I think we won't stop improving. So if you're interested in getting a deeper dive demo, we'd love for you to reach out to us, or if you just have questions too, we'd love to partner with you and stay connected. So with that, I do just want to thank you all for